Hello friends, welcome back to another video. So, the topic we are going to discuss today is hypertension. Hypertension is defined as systolic blood pressure of 140 millimeter of mercury or greater and diastolic blood pressure of 90 millimeter mercury or greater, or if anybody is taking any antihypertensive medication. Now, there are different types of hypertension. First, we have essential hypertension, which is 95% common in people and it has no underlying cause. On the other hand, we have secondary hypertension, which has some underlying cause. Now, we're going to see what are the causes of this secondary hypertension. First of all, we have renal. The causes that lead to hypertension are parenchymal, vascular, and some other. On the other hand, we have endocrine, miscellaneous, and some causes are still unknown. Now, if we talk about the classification of hypertension, here we have a normal person who has a blood pressure, systolic blood pressure less than 120 and diastolic blood pressure less than 80. Prehypertension leads to systolic blood pressure up to 120 and that goes up to 139, and diastolic blood pressure goes from 80 to 89. Now in the stage 1 hypertension we get systolic blood pressure of 140 to 159 and diastolic blood pressure of 90 to 99, and in the stage 2 hypertension, which is the most severe one, we get greater than 160 or 60 systolic blood pressure and over 100 or 100 diastolic blood pressure. Now, if we talk about the incidence in India, it is 25% of the urban population and 10% of the rural population suffer from hypertension. And 70% of all hypertensive patients are stage 1 hypertension, which is not yet severe, but it is dangerous. Now, 12% of the all hypertensive suffer from isolated systolic hypertension. Who's at risk? If we see, hypertension predisposing factors are advancing age, sex, men and postmenopausal women, family history of cardiovascular disease, sedentary lifestyle, and psychosocial stress, smoking, high cholesterol diet, low fruit consumption, obesity and weight gain, coexisting disorders such as diabetes and hyperlipidemia. Also, high take of alcohol may lead to hypertension. Now, here we have hemodynamic pattern in the hypertension. Here we see in the young ratio between young and elderly. Here in the young, you can see that if the blood pressure is high, CA goes up, it is multiplied by TPR, and that so in the elderly, if the blood pressure goes high, now the CO ratio goes down and is multiplied by the two sums of TPR. Now, etiology of systemic hypertension. First of all, we have renal, which is AGN, CGN, CPN, polycyst KD, that lead to renal artery stenosis. On the other hand, we have endocrine, that includes adrenal, acromegaly, exogenous hormone, hypothyroidism, and hyperthyroidism, that are caused by oral contraceptives, glucocorticoids. Now, some others, we have co-artication of the aorta, pregnancy, including HTN, pre-eclampsia, and sleep apnea syndrome. And why do we have to treat this hypertension? Now, hypertension may lead to a variety of diseases. You can see here on the screen gangrene of the lower extremities, heart failure, left ventricular hypertrophy, myocardial infarction, coronary heart disease, hypertensive encephalopathy, cerebral hemorrhage, preeclampsia or eclampsia, stroke, chronic kidney failure, blindness, aortic aneurysm. So these are all the diseases that can be caused by hypertension. Now, hypertension leads to all of these diseases. So that is all from now. And in the next lecture, I'm gonna teach you how to treat the hypertensive patients. So thank you so much for your time. See you in another video.